Hello, my name is Rupsha. I'm a second year PhD student in the School of Global Health. And my research focuses on the intersection of design and global health. So technically, I'm in sort of an interdisciplinary space. So I came through York. I did my Master of Design here as well with Dr. Shital Desai, who's currently my dissertation supervisor as well. And my master's thesis focused on sort of daily rituals for people living with dementia. So that's sort of the everyday nuances and how you do your everyday activities. And from there, I designed an augmented reality prototype. So a type of technology that casts virtual objects onto real life objects to help people with dementia with reading. And now my research focuses on sort of the systems and underlying structures around the quality of life for people living with dementia in both Canada and globally. And I'm looking at particularly experiences around loneliness. And how to make that better through technology, services, programs, whatever is needed to support people. So originally, I was very interested in sort of the intersection of health and design. I had worked in the industry a little bit, and I definitely saw there was like a gap in how we treat patient experiences. So that interested in me, got me interested in my master's. While I was doing my master's, I had the privilege of doing a research assistantships at my supervisor's lab, the Social and Technological Systems Lab. And then from there, I was really interested in people living with dementia, sort of the cognitive impairment and how that factors into everyday experiences, whether that's in a care setting or in the community. And then my PhD research, sort of born out of my master's research, I had the privilege of working with people living with dementia as well as their caregivers in sort of a semi-structured interview format when I was doing the research. And more I talked to them, there was definitely a gap in sort of community supports. People were experiencing loneliness, they were experiencing disconnection. I think also coming out of the pandemic, loneliness was top of mind for a lot of people because we were all sort of living the lives of, you know, people who do live with chronic illnesses that are sort of separated from, um, everyday life. So those things were quite interesting to me, and I wanted to explore them further. So I really enjoy working with people. I've had the privilege of working with a lot of different community partners across Ontario, the Alzheimer's Society, the Ontario Caregiver Organization, and most recently, I just did a co-design workshop with a rural community, Short Hills Retirement Community. And I really enjoyed interacting with people living with dementia there, care workers, as well as family members. Um, so I really enjoyed that interaction and also learning from people. And then the second thing I really enjoy is the creative part of my work. So coming up with solutions, ideating, wrapping my head around a problem and coming at it from different ways. So those are the two big things. I hope it brings visibility to, um, this population of people that is often sort of painted in a particular way by the media or by, our own perceptions, and to show that, this locus of creativity that we have, whether it's design or art, can be shared. Like, a lot of people have asked me in the past, like, what is co-design? And I think it is just making the design process accessible and making sure that everyone does get a way to participate, and it's not just experts like designers or researchers that participate in the process. Um, so I hope that um, my dissertation can add to that body of knowledge on how we can design interventions better for people living with dementia. Um, both on in a Canadian context and because it is global health, but in different country systems and contexts as well.